People who suffer strokes often don't recognize that the signs they're experiencing during a stroke signify brain damage, so they don't get to treatment in time. This is a tragedy because although there has been effective medication available to treat most strokes since 1996, a stroke patient must begin to receive this medication within just a few hours after their symptoms begin. Because people don't recognize the signs of a stroke, they wait too long. They may die or live with a lifetime of disability simply because they didn't recognize the emergency that is a stroke. There are three objectives for today's training. The first is that you will know the signs of a stroke. The second is that you will be confident in the immediate need to call 911 when you suspect a stroke. The third objective is that you will be inspired to teach this information to someone else. These objectives will save lives and reduce disability from strokes. You see before you three clear, obvious emergencies. No reasonable person would come upon the businessman on the floor with the phone in his hand and think, maybe he needs to call his doctor for an appointment the next day. No reasonable person would do that. Likewise with the choking man, showing us that universal sign of choking. No reasonable person would suggest that he take a nap and might feel better in a few hours. Lastly, no reasonable person would come across that school bus crash and decide to just drive home and check on things tomorrow because they might be better then. In all three of these situations, we understand that there is an emergency and there is a need to act quickly, either calling 911 or directly intervening. We understand that someone's life is in danger and we know to take action. Strokes are every bit as serious, but they can be far less dramatic. That's why we're here today, so that after today's training, you recognize the emergency that is a stroke and you take immediate action. We're going to see in the next slide a silent video, there's no sound, of a man showing us what a true stroke emergency can look like. Notice how calm this next image is, this next video is, in contrast to the three emergencies you're looking at now. Strokes are not always clear, dramatic events. This man is showing us one of the possible signs of brain damage that may accompany a stroke. He is suddenly unable to speak, although he's clearly trying, and there's no obvious reason why he can't. Contrast this man's behavior and calm demeanor with the clear emergencies we saw previously. If you see someone suddenly struggling to find words without any obvious reason, consider that such a person could be experiencing brain damage from a stroke. The emergency from a stroke is sometimes not obvious, but it's still deadly serious. Strokes are the number one cause of long-term disability and a leading cause of death. Strokes are so common that 1 in 6 of us will suffer a stroke. The odds are about double for those over 65 and for anyone of color. Every 40 seconds, someone suffers a stroke, and every 4 minutes, someone dies of a stroke. Anyone of any age can have a stroke. It's not just a condition that affects those over 65, but our odds of suffering a stroke do increase as we age. Stroke patients who don't get to treatment in time often live with a lifetime of disability they may have otherwise avoided with the early recognition of stroke signs. Let's get on the same page about what a stroke is. At its most fundamental, a stroke is simply blood flow interruption to the brain. Our brains are super sugar hungry, oxygen hungry organs. They're constantly fed a supply of nutrients and oxygen through blood vessels. When one of these blood vessels gets clogged, the brain tissue that was receiving oxygen and nutrients from that blood vessel immediately begins to die. It's an immediate occurrence. Our brains are constantly fed this, and when they stop receiving it, brain tissue immediately dies. You can actually feel your blood flowing to your brain. If you take two fingers and put them on one side of your neck, you can feel your pulse. You can feel your carotid artery pushing up blood and carrying with it nutrients and oxygen to your brain tissue. This is happening as we see in this image with a clear, unobstructed flow. Those red blood cells are flowing nicely and easily through to your brain, and your brain tissue is being nourished. With a stroke, one of the ways a stroke can happen is illustrated in this animation. We see that over time, that artery is becoming clogged. The blood flow is slowing until it eventually stops. As soon as the blood flow stops, brain tissue begins to die, and we have a stroke. One of the reasons stroke signs can be so difficult to detect has to do with the way our brains work. Different parts of our brains control different body functions. So, for example, the back of our brains, the occipital lobe, tends to control our vision centers. If we experience a blood flow interruption in the back of our brain, we may experience sudden onset vision changes. These vision changes can be very diverse. A patient who's experiencing a stroke in the back of their brain may have sudden onset blindness in one or both eyes, sudden onset blurry vision, sudden onset double vision, sudden onset color changes where everything in your field of vision has a different color. So this is a sudden onset event. My vision has been getting worse for the past 10 years. That's not a stroke. A stroke in this area of the brain comes on all of a sudden. We have sudden onset vision changes. If the stroke is occurring in our cerebellum at the base of our brain, for example, we may experience sudden onset balance problems. So all of a sudden we have trouble walking across the room. We're very dizzy. We have no idea why. Sudden onset balance problems can mean there's a stroke happening in the cerebellum. There was a patient, Senator Ray Lujan from New Mexico, January 26th of 2022, experienced a stroke. And his stroke sign was sudden onset balance problems. All of a sudden, he couldn't walk across the room. And he did what many normal, reasonable, well-educated people would do if this happens. He took a nap. The trouble with strokes is you need to get to treatment as soon as those signs begin. You waste brain time, brain health when you take a nap. So that's why we're here today, to illustrate why so many stroke signs go undetected, to hopefully help you understand better how to detect a stroke. One of the main and most common presentations we see with stroke patients is illustrated in these next few slides. A sudden onset facial drooping or body weakness often indicates a stroke. So with these three images, all three people have been asked to smile. And you can see that only one side of their face is able to execute that command. Only one side of their mouth is able to raise in a smile, and only the one eye above that raising lips is able to kind of crinkle up as a smile would have our eyes do. Only one side is working. But it's important to remember that not all strokes will present with this sign. Many strokes, the majority of strokes, will have one of these signs, this one-sided facial drooping or body weakness. But not all signs do. Going back to the senator from New Mexico stroke, he didn't have that as a sign. He didn't have this facial drooping as a sign. But it's one of the more common and easily recognized signs. But if a person is able to smile fully, it doesn't mean they're not having a stroke. The other quite common stroke sign is this one-sided or even double-sided body weakness. So all of a sudden, the stroke patient is unable to use one side of their body. If they're carrying maybe a coffee cup, they suddenly drop it. Their whole side will go weak, or their arm will go weak and limp, and they're not able to control it anymore. Sometimes with stroke patients, the patient, remember, they're suffering brain damage. They don't even realize that this is happening. They don't even realize that the right side of their body or the left side of their body isn't working because, again, they're having brain damage. They're not making sense. So these are among the more common signs. About 60 or 70% of strokes will present like this, but not all strokes present like this. This slide shows us more stroke signs that get us into closer to the 95% of strokes will present with one of these signs, at least one of these signs. So stroke signs are sudden and unexplained. We talked about the loss of balance or dizziness, the sudden onset loss of balance or dizziness. So this isn't you just came off of a roller coaster and you're dizzy. It's the sudden onset dizziness that you don't understand where it's coming from, the sudden onset vision changes or facial drooping, that body weakness. I think many of us have had an experience of you take a nap and you wake up and you slept on your arm. So when you wake up, your arm isn't quite working right. It's all tingly and numb. But as the seconds tick by, your arm is getting better and more functional. That's not a stroke. A stroke is sudden onset body weakness that's for no obvious reason. And then the difficulty understanding or forming words. Again, going back to the part of the brain that's affected. So, if the part of the brain that helps us produce speech has the blood flow interruption, we are suddenly unable to find our words, or maybe we slur the speech, or we start speaking gibberish. If the part of our brain that helps us understand words, we might be has a stroke, has a blood flow interruption, we might suddenly be unable to understand what people around us are saying. So the stroke signs are highly dependent on the part of the brain that is obstructed. So you're going to see in this next slide a video of a woman named Stacy who did not know what you now know. Stacy did not know the stroke signs. And over 3 days, she had stroke signs that came and went. Her stroke signs stopped and started, and that's another possible presentation as stroke signs can come and go. Stacy she drove herself, she made the mistake of driving herself to the doctor's office. And by the time she got to the doctor's office, her stroke signs had stopped. She explains the stroke signs to her doctor, who doesn't really understand. And he tells her, Stacy, you're just stressed out. You need to breathe deeply if this happens again. You're under too much stress. So Stacy leaves her doctor's office. She goes back into her car and the stroke signs return. She actually pulls out her phone in the car and she starts videotaping her stroke signs, takes that videotape to another facility where she is correctly diagnosed as having a stroke. So let's watch Stacy's stroke.
My name is Stacy Jappis, and I suffered three strokes from March 31st for 3 days in a row up till April 2nd.
It's all tingling on the left side, on the left side. The doctor said to breathe in, manage distress. And I'm trying. I don't know why this is happening to me. It happened this morning again. So now I'm taking a picture for an example of what happens. My tongue feels very numb. I just tried to take a drink of something. And I couldn't drink it very well.
My name is Stacy Jappis, and I suffered three strokes from March 31st for 3 days in a row up till April 2nd.
Drooping, and she's also producing some slurred speech.
It's all tingling.
We don't know if she's having vision changes. She doesn't talk about them, but those are the two stroke signs that we can see. Again, only one stroke sign is needed to raise this event to the level of an emergency that is a stroke. And the stroke signs can come and go. It's important to realize that if you've seen one stroke, you've seen one stroke. Many people will present in varied ways, depending on where the blood flow is interrupted in the brain. Even people who suffer multiple strokes in their lifetime, say a stroke happens and then 3 years later another stroke happens. Those two stroke events can have vastly different signs that present with each one. So every stroke is different. And it's just one stroke is one stroke. That's why we give you all of the signs, most of the signs that come with a stroke. We're going to see another person's stroke. This is of Congressman Ron Paul during a TV interview. He was live on camera when he started exhibiting stroke signs. And see if you can detect any of Congressman Paul's stroke signs from this next video.
Liquidated. We have to get rid of that. It's a bird. It's kind of violent. Liquidated. We have to get rid of that. It's a bird. It's kind of violent.
So Congressman Paul's stroke signs were a little bit different than Stacy's. Congressman Paul suffered a sudden inability to even articulate. He didn't have the slurred speech. He had just gibberish. He wasn't even able to form words. And then his left side of his face really started to droop. I encourage you to play that video again, go back and play it again, and really pay attention to the left side of his face. You can see a marked droop in his face. Sudden onset, and it was calm. He's relatively calm. He looked a little perplexed, confused. He understood something was wrong, but this is an emergency. Congressman Paul suffered a bona fide emergency that warranted a 911 call, as all strokes do. So I hope now we've accomplished the first objective for today's training, which is that you know what stroke signs are. You know how to recognize a stroke. That there's varied signs and they can be different for every person depending on where the part of the brain that's affected. But we've gone through those stroke signs, that balance trouble, the eye vision changes with the eyes, the facial drooping, the arm weakness, the speech changes. All of those are stroke signs. Now it's time to get to why it's important to call 911. And this gets into the reality that time is brain. 2 million brain cells die every single minute during a stroke. As soon as that blood vessel becomes blocked, we start to suffer brain damage. The sooner we get to treatment, the better our chances are of a full recovery. After only a few hours of suffering brain damage, there is a medication that can be delivered, but that medication, the risks of that medication outweigh the rewards. So we need to get to the hospital immediately after the signs begin so the doctors have plenty of time to administer the medication that we need for the best outcome from our stroke. And the best way to get to the proper treatment is to call 911. We're really getting into the second objective. We want you to call 911 as soon as you suspect a stroke. The medication that's available to treat strokes has been available since 1996, but we still see the vast majority of patients, up to 80%, depending on the study, arrive at the emergency room too late to be able to be given the medication. The FDA allows the medication to be given to stroke patients within about 4 or 4.5 hours after the stroke signs begin. So you can see that if you take a nap because you're hoping these signs will go away, you're really cutting out that short time window that is available to you for treatment. So we want you to call 911 immediately to really cut down that number and get more patients to effective treatment in time. One of the mistakes people make when they don't call 911 is they'll drive themselves to the emergency room. And this is so dangerous on multiple levels. If a person is suffering stroke, they're suffering brain damage. The last thing we want a person suffering brain damage to do is to get in the car and drive. If the person crashes and hurts themselves and now maybe they're unconscious and unresponsive when the paramedics do arrive, the paramedics are now dealing with a trauma situation. The patient's unconscious and unresponsive. The paramedics can't even assess that patient for a stroke. And they're dealing with trauma now, a whole different set of problems. If the patient who's driving themselves to the hospital crashes the car and doesn't hurt themselves but hurts someone else, it's such another needless tragedy. So to get to the emergency room safely, please don't ever drive yourself. Don't ever encourage someone who you think might be suffering a stroke to drive themselves to the hospital. The second mistake stroke patients make is they'll sometimes have a friend or family member drive them to the hospital, or a coworker, which is also another mistake because not every hospital can treat strokes. The medication that is available to treat strokes is powerful. The doctors and nurses at the hospital have to go through a rigorous certification process to be allowed to administer that medication safely. If you drive your loved one or you have a friend drive you to the emergency room because you think you're suffering a stroke and you end up going to the wrong emergency room, all you're doing is just destroying that short time window you have for effective treatment to even be an option. One of the first things paramedics are taught when they start in a new jurisdiction is where the stroke centers are. So the EMS personnel knows which hospital can treat you, and they will take you to the appropriate facility in a timely manner. There's another reason to call 911, and that's ultimately because it will save you time, which will save you brain. And it's not because EMS will drive faster. We just don't do that. The reason 911 will save you time is because when the paramedic suspects they have a stroke, that paramedic is immediately on the radio with the emergency room physician, telling that emergency room physician that they're bringing in a stroke patient. When the emergency room physician hears that EMS is bringing in a stroke patient, that emergency room physician starts to activate the hospital's stroke team. So the doctors and nurses who are trained to give you the stroke medication are being pulled from all over the hospital, waiting your arrival in the emergency room. They're getting the medication ready. They're starting their calculations. They're clearing out testing rooms and testing facilities so that as soon as you arrive, You can be tested, all because the hospital staff knows that time is brain and every second counts. Hospitals train intensively to cut down seconds from the time you hit the door to the time they can give you the medication. And all of that is wasted if you take a nap, or you drive yourself to the wrong emergency room, or you crash the car on the way to the hospital. Calling 911 will save you time in so many ways. It will get you to the appropriate facility in a timely manner. So that's the second objective that I hope is accomplished. We've understood what the stroke signs are, and we understand the value of calling 911 immediately when we recognize a stroke. The last part of this presentation is for you to be inspired to teach this forward. No one on the planet has ever administered chest compressions to themselves when they're in a cardiac arrest event. No one has ever done CPR on themselves when their heart has stopped. In a similar way, we see that stroke patients are really the least likely people to call 911 for themselves. This is a pie chart of one study, but it's indicative of many studies. When we look across the numbers, we see only about a third of patients arrive at the emergency room, a third of stroke patients arrive at the emergency room via 911. The other 2/3 tend to come by private vehicle. Someone will drive them or they'll drive themselves. When you look at the small segment of patients who arrive at the emergency room via 911, we see that only 4% of that small number are the patient themselves. So this slide shows us that if you are having a stroke, the chances are very, very small that you will call 911 for yourself. And this is for many reasons. In some cases, the stroke patient is suffering too much brain damage to even effectively execute the command of dialing a 911. The damage is too intense. They can't even execute that function. But another reason is just denial. A lot of stroke patients will deny that they're having an issue, or they'll insist that they just take a nap. So it's important to have advocates around you, if you want a safe environment, to know what the stroke signs look like so that they can activate 911 for you, because you are very unlikely to ever activate 911 for yourself. Knowledge has a shelf life. It's wonderful that you're taking this training today. Thank you for your time. Thank you for your attention. But it's highly unlikely that 6 months from now, 6 years from now, you will remember the stroke signs. So we want you to have a memory aid, something tangible that you can take with you, that you can review, put where you'll see it on a regular basis, so that these issues are in the forefront of your mind. The training is accompanied by magnets and wallet cards that look as these images do, that show the stroke signs, that remind you what they are. So if in a few years or a few months you come across someone who's suffering one of these signs, you might think, oh, maybe they could be having a stroke. The hope is that by keeping these memory aids where you will see them regularly, that you'll remember that the symptoms that they're showing could actually be a stroke, and you'll be confident in the need to call 911 if you spot those signs. So this wraps up the third objective and really the training. We want you to be a stroke champion. We want you to take this information out to your community, to your churches, to your schools, to your clubs, to your coworkers who aren't taking this training, to your family, to your children. Children have spotted strokes in adults, and children can have strokes as well. It takes about 2 or 3 minutes to explain to someone what the signs of a stroke look like, and to hand them a magnet and a wallet card so they can also keep the information fresh in their minds. We want you to take this information and teach it forward. On this slide, you see a QR code and also a website. The website has many free materials to help you stay stroke smart and to help you teach this forward. This presentation is on the website. There are slides, PowerPoint slides, and lots of information that can be downloaded. There's also a link to the Virginia Department of Health website where you can order stroke supplies for yourself and for anyone that you want to give them to. So we encourage you to teach this information forward. I hope that by now, toward the end of this presentation, the 3 objectives have been met, that you know what the stroke signs are, the balance problems, the sudden onset vision problems, that facial drooping, arm weakness, and speech problems. All of those problems can be indicative of a stroke. That's the first objective. The second is that you know to call 911 as soon as you spot a stroke. And the third is that you become a stroke champion and teach this information forward so that you have the best, safest environment for yourself if you do suffer a stroke, and then also so you can help someone else who may be suffering a stroke, because it's very unlikely that you will ever call 911 for yourself. So please teach this forward to your family, your friends, your coworkers, anyone who will listen to you. Be a stroke champion. Teach this forward. Give someone the magnets and the wallet cards, and make a safe environment for yourself and for those in your life that you care about. Thank you for your time.